When I was admitted to the School of Medicine, I got an email about the Masters in Bioethics program, and I was considering like a public health master's, and this was another option that came up. And when I was looking it over, I realized that it would give me an opportunity to have very rich discussions with my classmates and with professors and such, which I've always been somebody who loves talking with people, especially about complex topics. And so I saw it as a way to improve my clinical skills, specifically with decision-making with patients and things like that. When I initially saw the email about the master's program, one of the things that stuck out to me is that having these types of discussions with classmates and professors would feel like kind of a break from my medical curriculum, which can be very memorization heavy, that type of stuff. And so it would kind of remind me of where I was going, the types of decisions I'd have to make and things like that, and not just, memorizing muscle sinews and stuff in the anatomy lab. Another thing I wanted to mention is that I felt like it would help me stand out a bit as both a medical student and then as a residency applicant, just because it's a very unique approach to things like medical research and medical writing, and so far that's been very fruitful. So when I started the program, I took an introductory course in bioethics that taught me how to read and write and discuss bioethics from a number of different approaches. And then since then, I've taken a bunch of courses on different topics, both from medical humanities and bioethics. I took classes in film and writing, current controversies, both from an approach of bioethics and medical humanities. There's both tracks available to pursue, and so I'm personally doing the medical humanities track. However, I still do a lot of bioethics work, and I'm doing bioethics research as well. Earlier this year, I went to a conference in Boston to present on a poster I had made talking about a complex issue in bioethics with psychiatry. And so when I was giving that presentation, with a bunch of other medical students, different psychiatrists were coming up and asking questions and such. And I had many come up to talk to me because bioethics is such a great topic to discuss, especially compared to research that can be super in the weeds and things like that. It was very approachable. I was able to quickly catch them up on what I was writing about and then have a great discussion and learn about their clinical practice, which was really great. So I think there's two main things here. One of the biggest things I've learned is that it's very important to have discussions about end of life and complex medical decisions with your loved ones and family members, specifically those who are getting older in age, because a lot of the times people don't communicate that, and it can be very controversial and upsetting and things like that when family members don't realize what somebody's medical wishes were. And so it's important that everybody has an idea of it. One more lesson that I want to mention from the medical humanities aspect is making sure to keep the human in your clinical practice. And that goes for both your patients and yourself, and grounding yourself through things like making art, writing, even just talking to other people about your practice, concerns you have, things like that.